Communities of color face a double-edged sword with COVID. They're more likely to get sick, but less likely to get the vaccine. As our Jamie Perez shares, staff members at UW Health are doing something to help intersect these two competing factors.
Well, UW Health has staff members who are doing some outreach work to communities of color to inform them about the vaccine. So what it is, what the side effects are, and what the trial period looks like. And they're hoping that by having these ongoing conversations, it can help build back the trust that's currently keeping these people from getting the vaccine.
The first day that I got the first dose, I was extremely tired that evening, but I was so overexcited to be potentially part of history.
Dr. Shiva Bidar-Siloff knows her excitement about the vaccine is something that not everyone feels.
Communities of color have been disproportionately impacted by COVID-19. We have a historic mistrust of healthcare and health systems. That mistrust is based on some serious ethical wrongdoings in the past.
Bidar-Siloff used an online forum at the beginning of the month to share her experiences participating in a COVID vaccine trial, hoping to reach communities of color that are wary of the healthcare system. Fellow UW Health physician Dr. Jasmine Zapata used a key example of where the mistrust comes from: unethical medical experiments conducted with syphilis on black men in the 1930s.
A couple years later, when there actually did have a cure come out for syphilis, which was penicillin, they withheld that treatment to the men that were in the study.
As women of color now working in the medical fields, they're asking communities of color to weigh their options.
We're never going to forget, but my question is, will we forgive?
UW Health's Dr. Patricia Tejas-Hidon is hoping to set an example of the benefits of forgiving.
I knew I had a responsibility not only with myself, but with my community. So I educated myself very well about this vaccine and made sure that it was going to be safe.
Tejas-Hidon is also the co-chair for Madison's Latinx Health Council. She got the Pfizer vaccine earlier today, hoping she can inspire others to do the same.
This time, we need to make our voice heard by getting the vaccine. We need to show the community at large that we are as much part of this community as they are, and that we're going to actively participate on getting out of this pandemic.
Now, they're still working with other community organizations to do more online forums like the one you just saw, and they're hoping that more community leaders will be reaching out to them so that they can help get the word out and inform other people about the vaccine. For News 3 Now, I'm Jamie Perez.
If your organization is interested in hosting a similar forum online, you can contact UW Health's Dr. Shiva Bidar.